This program, is now 10 years old, going into its 11th year. And each year that goes by, as we enlarge the program and have more offerings, we see more and more what it means to patients. And that's what really is sort of the glue for our whole team.
The first time I heard about my diagnosis was about 10 years ago. And I was 55 at the time, so it was quite daunting because I didn't expect at that age to have a diagnosis like that. It was so new to me and everything was so new, quite overwhelming.
You suddenly realize that there's this poison in your body. It's been there for a while and it's growing. To say that causes anxiety is an understatement. They give you the options for removing it or irradiating it or somehow dealing with it so it's gone. But you learn too that there are side effects with all the treatments that include incontinence and impotence.
It can at first be overwhelming and feel hopeless, but there is hope. It's taken a lot of work and growth, but your life can go back to normal.
Luckily for me, I was presented with the option of the Prostate Cancer Supportive Care program, and the program was really life-changing. Well,
this has been very supportive to me. Gone through some of the sessions with them, they have sort of the group ones, and then I've availed myself of some of the private ones. They have the books, the information you need, and I've got that, and I've shared that with some of my family members, so they understand just what's going on with prostate cancer.
Just coming into this facility and just seeing this group of professionals that are here and what they already had in place was incredibly reassuring. So you felt like you were in good hands.
This particular location is familiar to our patients because many of them came here to see a urologist. This is where they got their diagnosis of prostate cancer. Instead of sort of sending them here and there all over Vancouver or Greater Vancouver or wherever, everybody is right here.
We work with other clinicians, physiotherapists, counselors, dietitian, and we're a network of collaboration to actually help provide comprehensive care for patients and partners as they go through the prostate cancer experience.
It's a privilege to work with patients and also with this team. I think we can provide an opportunity to support patients across a lot of different ways, including counseling. And I think that makes us a little unique and a little different.
It's like a gift to be able to work here. I'm working with somebody with their bowel or bladder control, and all this other stuff comes up because you don't work with a compartment in a human being. You work with a total person. And being in this program, I really can support that total person. And so if I recognize, there's some sexual health concerns, or there's some fear, concerns about exercise or diet, or the person is really struggling with the diagnosis or other aspects of their life, it's just amazing to be able to work with people, things come up, and I can work within a team and help people meet all of those needs.
At the end of the day, it's those kinds of interactions with each other about our patients that kind of keeps everybody really fulfilling our mission.
The sexual health clinic at the Prostate Cancer Supportive Care program actually helps individuals understand the impact prostate cancer treatment can have on sexual function and intimacy. We also look at helping individuals manage these changes.
Here in the sexual health clinic, patients can have up to 7 appointments with us, and this can last about 2 years. I think it's really important to talk about sex and sexual issues. I think one of the great things about this clinic is that really we're helping people move through change.
It's really important being in this role to have a sensitivity towards this subject because it is something very intimate and very private. We actually make sure that people feel safe, that they are respected, and they're treated in a very non-judgmental way.
It's been helpful in a lot of areas, particularly in terms of sexuality, the sexuality component. It was good to have a counselor who was able to talk to us in a matter-of-fact, down-to-earth kind of way, and her comfort with it helped me feel more comfortable with it.
just to have that expertise and not have to go back and forth to your family doctor who might or might not be really informed about these things, and having somebody you could communicate with somewhat even between appointments, just to have reassurance was great. And when problems would occur, there was always some place to go for help. It was a lifesaver, really. It was amazing.
Well, for me, the purpose of my clinic is to sit alongside men who are experiencing cancer, and that's anywhere from diagnosis to treatment decisions to post-treatment, and just be there as a support for them and their families. You know, I can see at times how helpful it can be just to talk to somebody, just to have someone to listen to them in a very sort of unbiased and supportive way. It's different than talking with friends or family or even physicians. It's sort of a unique experience. It's a unique conversation.
A lot of our patients don't really understand that this is not funded, for the most part, by the Ministry of Health or any other governmental agency. It's predominantly funded by philanthropy. We've been very fortunate over the years to be able to continue with philanthropy, but like any nonprofit, we can't continue if we don't have that support from the community.
You know, I went into physiotherapy because I think I liked the idea of helping people become independent with whatever function they had, and how to have full lives.
We all have the same focus. We all want to make sure that we give patients their voice. We want to make sure we give patients their choices, and we want to make sure that we give patients and couples empowerment. We're proud, both of us, and I'm sure all the team members are proud of what we do at the Prostate Cancer Supportive Care Program.
Well, it's pretty impressive that there's this system here with all these people dedicated to this one type of cancer, and that they've been doing it for a while. The people at the Diamond Center here are really good.
I think they're great. They've been very, very supportive, all of them, and there's a lot of good information. It's up to date. It's just a great support system. I'm very happy with it.
I know now that the program is accessible to everyone, which is amazing. Their care, their empathy, their understanding about the problems before and after care, it's really amazing. I'm very grateful. I started 10 years ago, and I'm still here in touch with them because their help and their service has been life-changing.
This place is as close to excellence in healthcare as I've seen, and if other places modeled themselves on this place, the whole system would be a lot better.
I'd like to, of course, first thank everybody for coming to our second dinner, which a lot of people have come back, and we're very grateful for their support. Of course, we're fundraising, but we also want to make sure that people are learning about prostate cancer, because half of the people sitting out there at the tables are men, and we want to make sure that there's awareness, and we also hope that, of course, there would be some consideration of helping us maintain our operations at the Prostate Cancer Supportive Care Program.